today we will be talking about what are the treatment options available with epilepsy, whether epilepsy can go away like a bad dream, and whether a child can lead a normal life having epilepsy. So once again, I'm Dr. Mona Gajre. I'm a pediatric neurologist and a developmental disorders specialist, and I practice in Mumbai. So let's talk about epilepsy today. So epilepsy, as I'm sure you've heard about it, and now that your doctor has spoken to you about the disease that your child has, you want to know as a parent whether this disease can go away. So epilepsy, just like diabetes or hypertension, can be controlled when the seizures are occurring. And there are definite treatment options available which your doctor would have started, which are known as anti-seizure medicines. So think of epilepsy, as I said, like any other chronic diseases like diabetes and hypertension. If you control it well with the medicine, you avoid the factors which are leading to fits or seizures in your child, then definitely the outcome is better. I would definitely and very strongly recommend that you keep a seizure diary for your child to know how many times the seizure is happening in a day, what is the length or what is the duration of the seizure, and what is the type of seizure. This will help your doctor to have a more guided and a more definite decision about how and which medicine to start. Because the anti-seizure medicines which your doctor starts, there are a lot of, probably more than 24 of medicines available in the market. But in children, few of them are licensed for use. And depending on the type of seizure, depending on the duration and the age of the child, also if the child has any other diseases that the child is suffering, your pediatric neurologist is a trained professional who will decide which other type of medicine. So, you may be thinking that there is another child with epilepsy and his medicine is different vis-a-vis my child. Because as I said, there are many factors that your pediatric neurologist thinks of before the child is put on a medicine. Now, typically when I see these children, if the child is seizure free, that means no fits happening for the last 5 years or so, 3 to 5 years, again, depending on what is the other factors that the child has, we start slowly decreasing the dose of the medicine and eventually take the medicine off the child. And we can safely say maybe that epilepsy is now resolved in this child. As I said, our aim and the main goal when we use an anti-seizure medicine is to see that the child is seizure free such that the child can lead a normal life. So if there are many seizures happening in a child despite 2 or 3 medicines, okay, or if the seizures are impacting his daily life, then sometimes the doctor may consider or your pediatric neurologist may refer to you to a higher center for epilepsy surgery. Epilepsy surgery are done in certain centers in India, which have a trained professional team to take care of this type of surgery. There are other forms also which can be used if the child is not responding to routine medicines, and this is known as vagal nerve stimulation or a ketogenic diet. Your pediatric neurologist would be the right person to guide you to these advanced modalities of treatment. If the seizures are well controlled, then definitely the child can lead a normal life, go to school, do all his activities on his own and have a fun, enjoyable and fruitful life. If the seizures are uncontrolled or if they are frequent, then of course we need to consult with your doctor again and see what are the other modalities which are available which can help your child to lead a near normal life. Thank you.